Good afternoon, everyone, and welcome to our today's special panel discussion Beyond Treatment United by Care in honor of World Cancer Day 2025. On behalf of 4baseCare, we are so happy to have you join us today. The theme of World Cancer Day 2025 is United by Unique. This theme celebrates the idea that every cancer journey is different and it's essential to offer personalized care for every individual. Today, we have come together with a goal of discussing how we can provide care that will focuses on every person's unique need and not just on their illness. We are joined with us, we are incredible groups of experts, an oncologist, a genetic counselor, an oncodietitian, and an oncopsychologist, each of whom will share valuable insight regarding the cancer treatment and how we can provide care in a more personalized and compassionate way. And I, Mrs. Aditi Mukherjee, Manager of Patient Care and Engagement Team, will be moderating today's event. But before I begin, I want to remind you all that this discussion is for you, patient and the caregiver. Your queries, your thoughts, your experience are at the heart of today's conversation. So please feel free to share them throughout the session. So now let's get started. To kick things off quickly, let me introduce to our panelist, Dr. Anjali Kulkarni, Radiation Oncologist, Vice President, RWE Strategy Analytics 4baseCare. Ms. Shalini S., Genetic Counselor 4baseCare. Ms. Harsha Joshi, Oncodietitian 4baseCare. And Ms. Jaitri Mandal, Psychologist 4baseCare. First of all, I would like to invite Dr. Anjali Kulkarni. Good afternoon, Dr. Kulkarni.
Good afternoon, Aditi. Good afternoon, all our viewers there.
Dr. Kulkarni, I would like to request you to share your thoughts on the importance of personalized care in cancer treatment.
So, as we all know, cancer is a very complex disease, and cancer, what we call, is basically a genetic disease that occurs when the normal cells mutate and they become the tumor cells. And most of these mutations are caused at the genetic level. There might be a combination of multiple factors, which include genetic factor and the environmental factors also. And that's how there are various risk factors associated with cancer. In that sense, every individual is made up of a very unique set of genetic characteristics, and that's how every tumor is unique. And when we devise a treatment strategy for the patient, it has to be obviously unique for that patient. Similarly, there are different physical characteristics of the patient, like age of a patient, the comorbidities like blood pressure, thyroid issues, kidney issues. Same time, very much important, his overall nutritional status, his psychosocial background. And in all these aspects, the patient is not only unique from his disease perspective, but he is a unique, or he or she is a very unique human being. So whenever we discuss about a cancer treatment, it has to be unique, which will consider a person before a patient himself. And that's how the personalized care has to be decided for each patient. It will not only include treating the cancer, it has to be the rehabilitation of a patient, making sure that he has a good quality of life. And that's how I think we are a team of experts here who will be helping us to understand what is a personalized care, and how in the modern days it is very, very important to have a very good quality of life for our patients.
Great insight, Dr. Kulkarni. Now, how does the theme United by Unique fits into cancer treatment today?
Yeah. So we all just say that every individual is unique. We all know. Same time, every tumor is unique. So it has its own unique characteristics. And in that case, every patient has a unique story to tell. We all know whenever the cancer diagnosis happens, somebody is totally in denial, somebody is in disbelief, somebody has a little acceptance level, somebody will be very very pained by that diagnosis. So the diagnosis of cancer and is unique not only its physical characteristics but in all other aspects. But we all should be united together as a team, and we should be able to have a optimized treatment protocol. And that's how I think today's theme is united in our care approach for a unique need of that particular individual.
Thank you so much, Dr. Kulkarni. I am sure this will be immensely helpful for our patients as well as the caregiver.
Sure.
Now, accepting the diagnosis of cancer and braving through the journey is indeed immensely difficult for any individual. So, let's go to an onco-psychologist to understand her perspective. Welcome, Jaitri.
Thank you, Aditi, for this warm welcome.
So, I would like to know from your end, why is taking care of mental health and onco-psychological counseling session is impactful for any cancer patient?
Here, we always need to remember that psycho-oncological counseling and mental health is the key in cancer care, because psychosocial support during your cancer treatment can help to manage your distress, anxiety, why me cognition, even fear of recurrence, and multiple psychosexual issues as well. So, here, psychological support or psychosocial counseling can help to manage your low mood, can help you to fight with all the negative challenges during your cancer treatment, also can improve the treatment non adherence and treatment abandonment as well. Here also, we need to understand during the cancer treatment, our patients can experience multiple types of cancer related fatigue. So, a psychologist can be very much helpful for the cancer patient to motivate them so that they can come out from all the traumas, all the distress and anxiety during the cancer treatment, and even the side effects as well. So, here, let me give all the audiences a very small example. A simple here and now approach or strength based solution focused counseling can help a cancer patient to focus much on the actionable steps which can enhance the quality of life, well being, and the entire treatment experience for both the cancer patients and their family members.
Okay, then can you let us know a little bit in depth what exactly a patient can expect during an onco-psychological counseling session?
Surely, Aditi. So, here in 4baseCare, we make sure that we are providing psychological support not only to the cancer patients but also to the caregivers as well. And here, let me tell all the audiences that it's not only about one single psychological counseling. We try to provide multiple follow up sessions as well. So, during the first psycho-oncological counseling session, as a psychologist, we try to assess both the psychological and the social factors. For example, their sleep pattern, their multiple coping strategies, distress level, anxiety level, what is the level of their fear of recurrence, and also their spiritual belief system, their coping strategies, what is their lifestyle pattern, etc., and so on. And depending upon that, as a psychologist, we try to provide the personalized, customized psychological intervention for both the patients and the caregivers. As I said earlier as well, follow up sessions also we provide to ensure the psychological support and strength throughout the entire cancer journey. So, here, let me give you a very small example again. For example, if we feel that our patient is experiencing sleep disturbance, for example, late onset of sleep or intermittent sleep pattern. So, here we are going to talk about the sleep hygiene techniques, which includes consistent sleep wake cycle, or probably practicing here and now approach, or simple mindfulness meditation, so that they will be able to manage their stress level, and as a result, they will be able to sleep better.
Understood. So again, I want to highlight one of the most important segment when it comes to onco-psychological counseling session. How a patient can deal with the fear of recurrence.
Absolutely, Aditi. It's a very important question that I have always come across during my psychological counseling session, which is fear of cancer recurrence or fear of cancer progression. So, here, for all the audiences and the cancer patients, I would like to say that mild level of anxiety is very much normal and is necessary as well, because that is going to motivate you for following a very healthy lifestyle, and also it will help you to visit your oncologist as per the schedule follow-up appointments. Having said that, we always need to understand severe fear or anxiety can affect your entire quality of life. So here we need to understand a few strategies so that you can manage your fear of recurrence. What is most important here, we need to understand what you can control. For example, it can be following a very good diet pattern, a very good sleep pattern, following a very healthy lifestyle as well. Number two, try to practice open communication. For example, with your oncologist, with your psycho-oncologist, with your family members for receiving reassurance. Try to practice mindfulness and self-care, which includes always try to focus on the here and now. It means what is happening today, what I'm feeling today, what I'm doing today, what my family is doing today, rather than thinking too much about what is going to happen tomorrow. Also, try to follow a very good walking pattern for at least 30 minutes per day. Practice yoga, simple breathing exercises, meditation. Try to like what you like to do. For example, simple, kind of practicing some music or probably spending time with your family members, your friends. Those are really going to be helpful. And last but not the least, don't hesitate to connect with any cancer support group where you can connect with the other cancer patients as well. They're really going to be very much helpful for you to manage the fear of cancer recurrence.
Now, there is one domain which is mostly ignored by many of us, that is the caregivers. Now, can you let us know how a caregiver can manage his or her emotional challenges or burnout while taking care of a cancer patient?
Absolutely, Aditi. You are absolutely right, because during the entire cancer treatment trajectory, most of the time we focus too much on the patients to take care of the psychological and their physiological health. And as a result, sometimes we do not get much opportunity to think about our caregivers' psychological and physical health as well. But here in 4baseCare, from psychologists, we ensure that we are going to teach a few strategies to the caregivers so that they will be able to manage their caregivers burnout. Aditi will be surprised to know that around 40% to 70% of the caregivers, they experience caregivers burnout while taking care of their cancer patients. So now let's talk about a few strategies. The most important for caregivers is that you need to practice me time at least 20 minutes per day without any doubt. Number two is try to set some limits and the boundaries. Try to say no if you feel that this is too much for you. Also, try to delegate some responsibilities to the other family members and, if possible, your siblings, your caregivers, the other caretakers as well. Also, try to follow a very healthy lifestyle. Try to get sleep for at least 7 to 8 hours at night. Try to make your body hydrated. Follow a very good diet pattern. Try to practice, mild physical exercise, yoga, meditation, and also try to connect with your support groups as well if you are in touch with any, so that you can connect with the other caregivers who are providing care to the cancer patients as well. And if possible, don't hesitate to connect with your psychologist so that you can get a proper psychological consultation. So always remember, these strategies will be very much helpful for the caregivers to manage their stress, prevent burnout, while providing the adequate care to their loved ones with cancer.
I'm sure, Jaitri, by implementing these useful tips, many patients and caregiver can bring some positive changes in their regular day-to-day life. Now, one of the most common questions which we are coming across almost every alternate day, that what should I eat? Now, let's go to an onco dietitian to understand more. Welcome, Harsha.
Thank you, Aditi. Hello, all.
Harsha, please let us know, why is onco diet counseling session important in cancer treatment?
First of all, general diet will help an individual review their eating habit, and diet counseling sessions will let them know how their diet should be. Diet counseling sessions in cancer care are very essential, as it helps patient to maintain their nutritional status, manage their weight, and help them manage their side effects related to the treatment they are taking. And cancer diet will personalize their diet. A personalized diet will help the patient boost immunity and recover better during and after treatment. And cancer patients should know that their diet should be personalized, and this will help them take control of their health and let them know that they are getting the right nutrient and right dietary guidance throughout their cancer journey.
So, Harsha, what exactly happens during an onco diet counseling session and how it can benefit the cancer patient?
During diet session, we assess the patient's medical history, their current diet, and the symptoms they are going through, and the treatment plan they are getting. Diet counseling sessions provide them with, they address their specific needs like managing their weight, improving their energy level, and we also guide them on increasing the intake of nutrients they are lacking. It can be protein or calcium or iron. And we also help them manage certain side effects like loss of appetite, diarrhea, or nausea they are going through during their treatment. And this is also a great opportunity for cancer patients and their caregivers to ask questions and discuss certain concerns related to their diet. And it also helps patient learn practical tips to make their diet tasty and healthy. During the end of the session, both the cancer caregivers and the patients will get a clear idea about how their diet should be.
Okay, so nowadays many diet forms are becoming suddenly viral. So, can you share your insight that is it safe for any cancer patient to follow such popular diet patterns like intermittent fasting or keto?
It is a most common question asked by many of the patients during the diet sessions, and most of the patients will already be following the diet called intermittent fasting with the all the informations going around the internet. But these popular diets are not universally safe for cancer patient and is not highly recommended during cancer treatment. These cancer diets or these popular diets may cause concerns like nutritional imbalance and will worsen the side effects like weakness and weight loss. Cancer patients should always consult with an oncologist or an oncodietitian before trying any of this diet. And what works for one might not work for another. And cancer patients should focus solely on nourishing their body, not restricting it.
Understood. Now, I'm sure many patients or the caregiver wants to ask you one particular question, that how does the onco diet counseling session plays a major role in managing the adverse effect of in cancer treatment?
This is also most important topic to address as most of the patient tend to go back to their old routine of eating habits once their treatment is over. But this will not help them manage their long term side effects. And during diet counseling session, we provide them with strategies to manage these long term side effects like loss of appetite, diarrhea, or nausea. For example, consuming a small frequent meal or including a nutrient dense food items to their diet will help them manage their energy levels and maintain weight. And recovering after a treatment is not that easy for anyone. So, following a balanced and personalized diet even after treatment is very important. And cancer patients should solely focus on improving their health during and after treatment. And cancer patients should know that food is thy medicine, and every cancer patient should consult with an oncodietitian once in their during their cancer journey to know how their diet should be.
Thanks to all our panelists for this enlightening discussion beyond treatment, united by care. Now, I would like to request the participants to share or type your questions in the chat box. You can type in any regional languages, and our care companions will assist you in translating these questions, and our panelists will address your queries.
I think, Aditi, before we take the question, I think the another important part of our webinar is the genetic counseling. And we have an
Yes.
expert genetic counselor with us. So would you like to ask her a few questions and then
Yes,
for our
yes.
viewers'
Sure.
benefit?
Sure, Shalini. So I would like to know from your end why the genetic counseling session is important in cancer treatment.
Firstly, thank you, Aditi, for the warm welcome and good afternoon, everyone present here. So, genetic counseling is very crucial in cancer care because it helps in understanding the inherited risk of cancers and also the future risk of cancer for an individual, as well as the screening for the at risk family members. Not only that, genetic counseling also helps in understanding the nitty gritty of the genetic testing a patient is undergoing, as well as understanding the report in the most simplified manner.
Okay, Shalini. So, what exactly happens during a genetic counseling session?
A good question, Aditi. So, this is a very important question to address because most of the patients and caregivers have doubts. What happens during a genetic counseling session? Why is it important to undergo the counseling session? So, genetic counseling session is of two types. One is a pre-test genetic counseling session and a post-test genetic counseling session. So, during a pre-test genetic counseling session, the genetic counselors will collect the personal history of the patient, such as the medical history, lifestyle habits, comorbidities, etc. And also, the genetic counselors will collect in detail family history, that is, with respect to cancers. So, based on all these details, the pedigree is made, or what we commonly call as the family tree. So, based on this evaluation, the genetic counselor will suggest the best suited genetic testing for the patients, as well as we help them understand what we are going to do in the genetic testing and what are the possible outcomes from the genetic testing they can expect. And once the report is released, the post-test genetic counseling session is conducted, where the genetic counselor will help the patient understand the report in the most simplified manner. And also, we also provide the screening and management for the future risks of cancer as well as the at risk family members.
Okay, Shalini. So, how many types of genetic testings are available?
Yeah. So there are two types of genetic testing available. One is a germline genetic testing, which is done on the blood sample to understand the hereditary aspect of cancers for the patients. Second kind of testing is a somatic testing, which is done on the tissue sample, which helps in understand the course of treatment for the patient best course of treatment for the patient, as well as what based on their molecular profile of their tumor. So this somatic testing can also be done on the blood sample, which is called as a liquid biopsy. In case the tissue sample is not available, the testing can be done on the blood sample as well. So from the somatic testing, how it helps the patient is that we'll be able to know the eligibility of next generation therapy such as targeted therapy and immunotherapy, which at 4baseCare we offer and specialize in.
This is extremely insightful information. I'm sure that all the patients and the caregivers will be benefited by such an useful information shared by all. Now, we have already received some questions from the patients and the caregiver. So one of the caregiver has shared a question with us. My brother is using too much mobile phone at night. Can't sleep, not sleeping. Sleep pattern is completely disturbed. What can be done to deal with this situation? I would like to request Jaitri to address this query.
Thank you, Aditi, for this question. And what I assumed from this question is that probably your brother is receiving cancer treatment. So, here, let me tell you that there can be many reasons. First of all, we need to understand that why is more important than what. So, we need to focus on that why your brother is using the mobile phone and why he is not able to sleep at night. So, let me tell you a few probable causes. Number one, it can be the treatment side effects also. It can also be the stress. And we all know that whenever at night we lie down on the bed, so many negative thoughts start coming into the patient's mind. As a result, the sleep pattern becomes absolutely distorted. Number two, it can be that probably the patient is taking too much rest during the daytime as well. As a result, he is not getting the urge to sleep at night. So here we need to fix what we call as the sleep wake cycle. And for that, it's very important that the first and foremost important thing is that we need to regulate, we need to be very consistent in choosing the right time when your brother is going to bed for sleep. Number two is that which is very important. I always suggest as a psychologist, whenever you're going to bed, try to practice certain strategies, and we call it that sleep hygiene techniques. For example, wash your face, wash your foot, wash your palm before going to bed. Number two is that try to practice mild mindfulness breathing so that it will help you to reduce your stress. Number three, try to avoid mobile phone as much as possible. Rather than probably listen some very mild soothing music, those can be helpful for you. So let me tell you that multiple ragas are there that can also be helpful for your brother to sleep better at night. So yes, he can use the mobile phone, but he is not looking into the mobile phone. Rather than that, he is listening those ragas that can be beneficial for him to sleep better. So in a nutshell, if I summarize all the points, number one should be he can be mildly physically active during the daytime. Number two, following a very consistent sleep wake cycle at night. Number three, practicing mindfulness breathing and other relaxation strategies so that he can sleep better. And fourth point is that listening some very mild Indian ragas, multiple musics are there that we basically use as a part of musical therapy as well, so that he will be able to sleep better at night.
Okay, we have received another question. My mother has finished all her chemo and is now very healthy. But now she has a lot of pain in her legs. What is the reason for that? I would like to request Dr. Kulkarni to address this queries. She is the person.
So I think a pain in the leg might have multiple reasons. It can be as simple as dehydration, not consuming enough liquids or enough water might lead to a discomfort in the legs, which might sometimes feel like a pain for a cancer patient. The second most important might be due to a side effect of a chemotherapy drug. So we all know there are few side effects for every chemotherapy drug. Some of them last for few days, some of them last for few months. And in that case, you have to go back to your doctor who had prescribed you the treatment. And you can tell that I'm having the consistent pain in the legs, which is affecting my mobility, which is not allowing me to sleep peacefully. And he might look back into his treatment regimen, and if at all there are one of the side effects of chemotherapy drug, usually it goes in a matter of few weeks. But if some additional supplements like vitamin B12 or any other things are required, I think he will be the best person to prescribe you. So that's the way it will be taken care.
Great insight, Dr. Kulkarni. Now, my future generation is also risk free, they said. But how can I make sure to safeguard from cancer? Shalini is the best person to answer this.
A very good question, firstly. So, basically, I'm just presuming from the question asked, the person who has asked the question is affected and is worried about the family members who could be at a potential risk. So, what I would, or generally, genetic counselors usually advise is the affected family member first undergo the genetic testing, and based on their report, we suggest who are the potential potential risk of family members who could be at a potential risk of cancers, and accordingly the screening and management protocol will be suggested.
Thanks, Shalini. Now we have received one question from caregiver. Sharda Nirval, my wife, as on date has normal reports, but one major issue is when she speaks loudly or takes stress, she gets sweated for 2 to 5 minutes, and after 5 minutes, she feels cool for 2 to 5 minutes. So,
I think what we call as a psychosomatic symptoms, right? So some kind of a psychological factor which comes out as a somatic. That means the physical symptom the patient gets. I think there are multiple things going on in her mind, and there might be some kind of stress, anxiety which is there. And if it is really very severe, added with that, if she's not taking enough fluids, it might come out as a physical symptom of sweating. But I think as long as she's cooling down herself and talking to you people and making sure that she becomes normal in few minutes or say half an hour, I think it's fine. It's the part of life, and that's how the theme very aptly says, united by unique. So this is a very unique symptom, and we have to address it very united as a family, as a caregiver from your side. And if at all required, there are experts like here, who will be helpful to you. But I think it's a very transient symptom, so it will, I'm sure she will be able to overcome it very soon.
Well said, Dr. Anjali. Now, again, one question from one of the caregiver. Can you throw some light on sugar intake and cancer prognosis progression? Is it true or a myth that cancer progression happens if sugar is consumed? Who else can answer this question better than Harsha?
This is one of the most common question asked, whether sugar is the cause of cancer. Absolutely, sugar is a cause of cancer, but it is not the only cause. Simple sugar are there, and there is complex sugar. So simple sugars comes under processed food, refined food items, and fatty food items. All those preserved and processed food items comes under simple sugar. Those food items will increase the risk of cancer, and it will it will increase the risk and the progress of cancer. But complex sugar comes under vegetables, fruits, and whole grains, nuts. So including these kinds of sugar will not affect your diet or will not affect your sugar level. So avoid refined or processed or preserved food items, those simple sugars, and go for more of complex sugars. Fruits, include more of colorful vegetables, include more of whole grains in your diet, include more of nuts and seeds. So that will help reducing the risk of cancer.
Just to add to Harsha's point, I think cancer recurrence is morely depending upon the tumor characteristics. So some tumor, what we call, are biologically aggressive. So whatever said and done, they will come back. Some of the tumors are less aggressive. In that case, the patient will have a disease-free survival for a longer period of time. So it's a very, very complex phenomenon of disease coming back, and some of them will be a direct cause like a tumor biology, some of them will be, I will say, supplementary or a complementary cause. So in that case, some few studies have proven that excess sugar intake might be one of the cause, because that fuels the tumor growth. So these are all theories put forward. uh, the underlying thing is, have a healthy, food habits, and consult onco dietitian if you are not very sure about what you are eating is really helping you or not.
Thank you so much, Dr. Kulkarni and Harsha. Uh, Again, another question. Usually, we know about cancer when it reaches third and fourth stage. So, my question is, how cancer gets generates and what is the preventive care for cancer disease?
So I think that's a little unfortunate part of this disease, because every time in a very early stage, we will not get any obvious symptoms to catch it very early. Take it a simple case of, say, a stomach cancer. It might start with severe acidity or indigestion, or changing bowel habits. So we all attribute it to the food we ate outside, or the festival season going on, and people who eat high chilies or high spice level blame it on their food habits and things like that. So it is getting, actually it's quite challenging in that sense to identify that is it a cancer or it's a simple gastrointestinal normal physiological problem. And that's how I think most of the cancer uh, become very severely symptomatic in their stage 3, stage 4, when they grow bigger in the size, or they try to cause you very obvious symptoms. So somebody is losing weight, for first 1 or 2 months he will be very happy that I am doing there is a weight loss. But after third or fourth month, if there is an unexplained weight loss, there is a sudden weight loss for a few kgs, and the overall look of a person become like a very malnourished or things like that. I think that is a wake up call when people go and try to do ultrasound or a CT scan, and then we will be usually the clinician find out something not very good with their systems or something in the liver, and then we go refer the patient to the oncology expert. So prevention is a very very challenging concept overall in oncology. But having said that, there are few cancer which are very very obviously are, I will not say preventable, but which can be caught in a very early stage. So the most common example are the oral tumors, where anything going wrong with the oral cancer tumors, and somebody consuming oral tobacco or any form of tobacco should be very aware of that. So any ulcer which is not going for 2 to 3 weeks, any white patch in the mouth can be a very very early warning sign. Similarly, in case of a breast cancer, a woman who does a very regular breast self examination find herself having some lump which is say growing, which is not going up, it's throughout her menstrual cycle, might be a warning sign. Similarly, somebody's the prostate cancer, the people in the old age group seeing little blood in the urine, which might be the warning signs. So few of the symptoms are definitely things to be look out for, but make sure that any symptom which doesn't go in say 3 to 4 weeks, you have consulted a normal physician, he has given some initial line of treatment, and still the symptom persist, it's the time to visit an expert, or it's time to go to a hospital, or at least do a basic radiology examination like ultrasound, x-ray or a CT scan, to identify whether it is something really abnormal, and that abnormal thing is looks to be suspicious, which might be a cancer.
Thanks, Dr. Kulkarni. In this context only, we have received another question: how to avoid cancer for future generations? I would like to request Shalini to address this query.
Yeah. So, like I mentioned earlier, how to avoid future risks of cancer is firstly, the affected family member. Always, it is advised the affected family member undergoes the testing. That is, like I mentioned during the question, Aditi mentioned as well, the germ testing to be done firstly by the affected family member, and based on their report, the first degree relatives, that is the patient's siblings, children, as well as the parents, they undergo the screening only for the particular report finding, that is the pathogenic or what we call as the disease causing variant which is identified, that to be tested by the the health individuals in the family. And based on that, the management and the screening protocol is provided by the genetic counselor.
Thank
But again, I think the fine print is no genetic report will avoid it. It will help you to identify your risk as an individual and for your families and the generation. But then you have to be a little extra vigilant if there is some risk, familial risk, or some kind of genetic test is flagged out, and it's not avoidable. It's just that you remain at that caution point, you follow the preventive protocols. Say in the breast cancer, instead of doing only mammogram, if the familial risk is there, lot of time the protocol is to do MRI of the breast. So MRI will tell you sub centimeter or a very small abnormal thing in the breast tissue, and that will help you to be reaching out to a oncologist or an expert early on, and make sure that things are normal or not.
Thanks, Dr. Kulkarni and Shalini, for addressing this very important query. Now, again, can certain foods support the body in managing cancer related fatigue or boost the immune system? Harsha?
Uh, yes, the answer is yes. Actually, there are certain foods which can boost immunity, and for example, antioxidant rich foods. So when we go for antioxidant rich food, it certainly suits with vitamin C rich food items like orange or mosumbi, having amla, or including those colorful fruits and vegetables will improve your or boost your immunity and manage your immunity level. Including those certain foods regularly in your diet is very important. Whatever food you are taking, to boost your immunity, wash with warm water or hot water before consuming it. Be hygienic with your food eating practices. While washing it also, use a very, like, use a sterile water like hot water or warm water before consuming the fruit items. And salads, as of now, if your immunity level is on the lower side, if your WBC count is going on the lower side, avoid salads or uncooked food items or raw food items. Even if you wish to take those foods, boil it or blanch it, after that you can consume it. So boosting immunity is very much possible with food items like vitamin C rich food items.
Okay, again, one caregiver has posted one query. Uh, my mother gets to know about the diagnosis 2 months back, and after that, she has stopped all her daily routine almost, and she's not ready to talk to anyone, or she's not ready to do her day-to-day jobs properly. How to manage this? I would like to request Jaitri to help the caregiver.
So here we need to understand that, sir, that accepting a diagnosis, it's not a one day phenomena. Being diagnosed with cancer creates lots of trauma and pain within the patient's mind. So here we need to give your mother time, at least a couple of months. So let me explain you a few things. It starts from denial, then it goes to anger, then it goes to bargaining, then it goes to depression, and after that only the last phase, which is known as acceptance, as per the theory and the researchers. So I assume that now, as you said, that it's a very recently diagnosis. So probably your mother will be in either the bargaining phase or the denial phase, but not in the acceptance phase. So I will request you that kindly give her some time. Also, as a caregiver, you need to give yourself a couple of months as well to accept the changes and the treatment protocol and the side effects that your mother is experiencing currently, because we always say that if any patient is diagnosed with cancer, it's not a disease for the patient, but the entire family is affected. So here the conclusion should be just give her some time, because we need to understand that being diagnosed with cancer, it's not so easy for any patient. So as I said, probably we need to give a couple of weeks or couple of months so that your mom will be able to reach from either bargaining to acceptance or probably denial to acceptance.
Thanks, Jaitri.
So, Jaitri, do you think any kind of medication or counseling will help in this case?
Surely, ma'am. I would like to say that here the consistent counseling for the patient can be really helpful, because first, as a psychologist, we would like to explore that what is her level of diagnosis, probably and also what is her level of awareness about that diagnosis, because in most of the cases we have seen that the patient is partially aware about the diagnosis but doesn't have the entire picture, and as a result she has so many doubts that, and also lack of clarity about exactly what is going on, what is going to be my treatment protocol, how long my treatment will go on, what side effects should I undergo, and all the questions. So as in the counseling sessions, what we try to assess, that number one, what is the level of understanding about the diagnosis and also the prognosis part, for like from patient's perspective, and what are the factors those are distressing the patients a lot. And number two, after that we slowly try to make her understand that, as I spoke earlier, it's always about the here and now approach, because the patient is worried, because most of the cases we have seen that the patient is thinking too much about the future, like what will happen in future, what side effects I can undergo, bad happens with me. So slowly through the psychological counseling session, we need to bring back her thought process to the present. Like you need to focus exactly on the present, try to focus on exactly what your doctor is telling you now, try to experience all the small step that you are crossing. So it's about a one day at a time. And ma'am, most of the cases we have seen that the patient starts understanding the problem within probably a couple of months, and also starts adapting to the new changes as per the treatment protocol. So I must say that two important things are here. First of all, we need to give some time for the patient, and number two, the slowly making the patient understand that it's not about the future anticipation, rather than it's always about the present, and taking always one step at a time.
Thanks, Jaitri and Dr. Kulkarni, for this immensely great insight. Now, we have another question: how to connect with the experts on the panel for this consultations. I have some queries for each one of them for a cancer patient. Okay, now I would like to address this query. We have an app called Oncology. You can post your query in Oncology app, and Dr. Anjali Kulkarni, Ms. Shalini S, Ms. Harsha Joshi, and Ms. Jaitri Mandal are available in this app to address your query and further doubt clarification. Now, we are almost at the end of today's discussion. I know there are lots and lots of questions were asked, but due to the restriction in time, we could not answer all your questions. But as I have told, all the panelists are available in Oncology app to address your queries and for further doubt clarification. Now, I would like to request you to share your feedback regarding our today's discussion so that we can improve in future as well. It was great interacting with you all. Now, for booking any counseling session or for any doubt clarification, you can directly call us at our central number +916366843415, or you can mail us at info@4baseCare.com. Today, I would like to express my sincere gratitude to all the patients, caregiver, and the panelists for being present in today's discussion. Today, this initiative has raised awareness regarding Beyond Treatment United by Care in honor of World Cancer Day. On behalf of 4baseCare, we emphasize the importance of personalized care for every individual. And we know that personalized care is important, which will focuses on every person's unique need and not on just their illness. So, as I told, we are abide by united by unique. Thank you all once again to all of you who have made this event possible.